I think it was about 13 years ago. I came up here to do a locum and just really liked working in the emergency department. It was just, for me, it was just the right size. You get a mix of absolutely everything because of the geographic situation where we are. And it's a really good size in that you don't have the super subspecialties and trying to figure out who gets admitted under who or what to do with them. You can just, as I say, ply your trade as an emergency physician. So it's small like that, but it's not too small because we don't have to send much stuff out at all, actually. We've got a good ICU, good backup services in paediatrics, physicians, renal physicians, respiratory physicians, obstetrics. So most of the major specialties we've got support in. So we only really have to send away the neurosurgery, cardiothoracic surgery, that sort of stuff. So I just really enjoyed working in that environment where I saw lots of different things and was able to just treat them as I saw fit. Most people sort of think it's probably out in the backwoods going to Dubbo, but interestingly when they come out here, most of them say they really love it. So we actually have a lot of people who fly in and just have come regularly for years just because they really enjoy the work that they do. Last few years we've had a brand new surgical unit, a brand new obstetric unit, brand new theatres, state-of-the-art theatres, and we're currently getting a new emergency department, new ICU, new radiology department with MRI, a cath lab. The emergency department will be, it's been designed by clinicians, and we think the flow will be really good, and we think that it'll be a good, nice, practical place with plenty of space to work in. When I first got here, we saw 23,000 a year, and now we see about 33,000 a year. So clearly the numbers are growing. Dubbo itself is a growing area. It's a regional centre, so there's lots of people coming in, and it's growing. So clearly we're going to need more emergency physicians and more registrars. We are actually a training department, so we train emergency registrars. We're accredited with the college for that, and we think we actually have got a very good training program for them. A, because of the great case mix they see, but just because of the different way that people come in. They come in from long distances. We do a lot of telehealth with the critical care line. We try and get registrars involved with that, and some of the emergency physicians involved with that as well. And most people find that quite satisfying. One of the great things about working here is, and it's once again it's to do with the size. It's, you know, there's a reasonable amount of senior physicians, as in when I say physicians, I mean physicians, surgeons, all sorts of doctors, and because of the size, we do all know each other, and it's so much easier to get help with one of the specialists when you can just pick the phone up. You know them, they know you, and it doesn't take long before you do get to know people. And there's a general air of everyone's all trying to help each other. We're sort of all out here together, and it really is a very collegiate place to work. I can't speak more highly of that.